Let us discuss few most important benefits of hanging in SCI patients. Number 1, it decompresses spine, which improves in fluid circulation and reduces pressure inside the disc, and thus helps in proper intake of nutrients and proper blood supply to the brain and spinal cord. Number 2 is posture correction. ACI patient mostly develops scoliotic posture, thus while doing this activity, it also stretches out the upper body, hence aids in posture correction. Number 3, it strengthens scapular muscles. In this case, the patient has developed winged scapula, and thus by doing this activity, we can stabilize the scapula and bring it back in its normal position. Here are few exercises which can be done with VAN for the upper limb strengthening. In the first exercise, the patient is commanded to do shoulder flexion. This majorly targets our anterior deltoid, coracobrachialis, and pectoralis major. In the second, he is holding the VAN horizontally over his head and commanded to do side bend. Here, the patient is pushing the van forward with resistance band attached on either side, which is challenging the task. The major muscles involved here are triceps, pectoralis muscles, and deltoid. Similarly, we can also ask the patient to perform the same movement in different directions. Like here, he is pushing the van in forward and downward direction, which can also be done in upward direction as well, so as to target the specific group of muscles necessarily required for oval or shoulder muscle strengthening.
Our patient Satish, 60 years old, case of lateral medullary syndrome, is performing mini squats on Bosu ball, in which the unstable surface forces him to balance and also promoting knee and ankle mobility. In this another activity, the patient is performing weight shifting on either side on Bosu ball, promoting knee and ankle mobility while challenging his balance. In this clip, the patient is walking over the trampoline. This activity will help him improve balance, dynamic gait, and also improve his falls efficacy. In this clip, the patient walks stepping over the obstacle, which will help him improve gait velocity, stride length, walking endurance, and obstacle clearance capacity. In this clip, we can see the patient is enjoying cricket. This gaming approach promotes repetitive task-specific training and active engagement of patient, enhance neuroplasticity of brain and motor relearning.
Our patient Mayuri, a case of Friedreich's ataxia, is working on performing lunges. Lunges will target lower extremity strength, core control, balance, and weight shifting, which will help in everyday ADLs like bending, reaching, and transfer tasks. Here we are performing stair climbing with weights. It is known that in ataxia, axial weighting, in this case to the ankle, is known to improve gait in ataxic individuals. Stair climbing will require balance, body stabilization, and simultaneous coordination of bilateral limbs. It has the following benefits of decreasing the sway, increasing joint compression, which is going to facilitate co-contraction of muscle and provide stability. In the next activity, our patient is performing kneel walking. Kneel walking both forward and backward with holding a bolster in her hand. This will help in increase trunk stability, core stabilization, trunk strengthening, and strengthening of the extensor group of muscles as well. Walking with a bolster provides dynamic gait training with added weights to provide stability.
Just get your shit and go. Man, you can't the bird like me. It's like I'm up in the club on a Saturday night.
this video, we will see few exercises which are mainly targeted for hip balance and back muscle strengthening. In the first activity, we will put the patient in a quadruped position. We can secure this position initially with the help of a peanut ball, and once the patient gains some stability and confidence, we can remove it. We can also use a bolster and place it just close to the knee joint so as to prevent any kind of backslip of the foot. And in this way, with the help of caps and cones activity, we can promote hip balance. In the second activity, the patient is asked to do bridging. Here we are assisting the movement initially with the help of a bar and a TheraBand. This activity helps in activation of glutes and core muscles and thus helps in hip balance. Third activity is pushing the wheel. In this activity, the patient is in half-lying position, that is the upper half of the body is bent at the hip level and the trunk is raised from line to any angle up to 30 to 40 degree as per the comfort of the patient. Then the patient tries to push the wheel in a forward direction and alongside tries to elevate his upper body so as to achieve a sitting position. This activity majorly targets the core muscle strengthening and also provide trunk stability.
Our patient Yash, 17 years old, case of cerebellar ataxia, is performing forward bending in standing and raising 2.5 kg dumbbell in each hand, aiming strengthening of core and upper limbs, flexibility of spine, and overall body balance. In this another activity, he is performing caps and cones reach outs in standing to attain static standing balance and hand-eye coordination. Here in this clip, he is propelling a 15 kg weighted box with kneel walking to achieve hip stability, core strengthening, and overall trunk balance and stability. Now in this clip, he is performing abduction and adduction for abductors and adductor strengthening and to increase range of motion. Lastly, he is walking in assistance with walker to boost his confidence and to work on multiple muscles at the same time. Walking plays a crucial role in ataxic patients as it involves leg-eye coordination, balance and stability of the entire body.
This is a case of a 35-year-old male, SCI injury, level D12L1. Here in these activities, we are doing upper limb strengthening, which is combined with thoracic extension in a prone lying position. Then the patient is commanded to do various shoulder movements, like here he is doing shoulder flexion. Similarly, we can modify these activities by using TheraBand and do shoulder retraction, which mainly targets middle trapezius and rhomboid. In a high sitting position, we can specifically target sitting balance by training hip control through these simple functional activities. With the help of push-up bar, we can train weight shifting. These activities not only help in achieving sitting balance but also strengthens arm muscles.
Here, we are performing activities that aim to promote static sitting balance. Taking the ball in forward, backward, and upward motion challenges sitting balance. Another modification is using a 2 kg medicine ball in oblique direction, which targets core strengthening along with sitting balance.
video, our patient Hemant, SCI level C5C6. Here the patient is sitting on the abductor machine and is performing trunk extension, which increases the back extensor muscle strengthening. Here he is performing an activity on the hip glute machine with added weights, which aims to target the core, glutes and quadriceps. In this next activity, he is performing side bends which targets the obliques and is an useful means of functional stretching. In this activity with the legs abducted, we ask the patient to throw a tennis ball aiming at the stumps. Here we aim to increase the shoulder ranges with the throwing motion and strengthen the hand grip with holding the ball.
This video is for all the physios who find it difficult for their patients to do kneeling and perform bed mobility activities due to poor hip control. Being a physiotherapist, we all know the importance of kneeling in rehabilitation, as it majorly helps in creating conscious alertness of the body by developing initial upright postural control and for promoting hip stability, which are necessarily required for transitional activities like crawling, standing, and walking. And hence, start with these very basic and simple activities like performing supported kneeling and then gradually proceed with balancing on single hand. When the patient feels confident enough to leave both his hands, then start initiating open hand activities, which will help in controlling trunk and provide hip stability. And in this way, the patient will learn how to control and balance his hip really well. And now we can proceed further to train these bed transitional activities from lying prone to kneel sitting so as to make him perform bed mobility independently.